Hello, this is Dr. David W. Kim. Today's video rhinoplasty blog is a little different from some of the past blogs that I've done. This one focuses on some of the unique challenges and complexities of this operation, and why as a surgeon one must use both the left and right sides of their brain in order to tackle this challenging procedure and create consistently good outcomes. The following slides are taken from a presentation I've given in rhinoplasty symposiums throughout the world. This is normally to an audience of surgeons wanting to understand how to do a better job as a surgeon, but I think it would be helpful to folks interested in the process of the thoughts that go into the surgeon's mind as you approach rhinoplasty. The operation is a very difficult operation because of its unique anatomy within the nose, which is very complicated and highly three-dimensional. And the fact that the medium of rhinoplasty, the bone and the cartilage, are not very compliant compared to the medium of a sculptor such as clay or marble or wood. And even when you get those structures into perfect place, the process of healing and scar contracture can cause tension or strain and cause change. The idea that surgery is just a physical outcome is wrong. In order to create an ideal nose, you have to have a clear mental picture of what an ideal nose is. So therefore, as a surgeon, it's critical to use your mind to reach that outcome. The challenge of rhinoplasty is how to create this ideal mental outcome when you start with so many different types of baseline anatomy with so much variability. Many surgeons are sort of stuck on this idea that this is a left brain process. And the left brain, of course, is responsible for things like logic and analysis, for critical thinking, and it tends to focus on the process or how the surgery is done. But what's really critical is to remember the right brain. This part of our brain is important for creativity, for spatial awareness, for images and emotions, facial recognition, and in the world of rhinoplasty, it helps us stay grounded to the goals, or the why. The left brain part of this procedure can be thought of as controlling the aspects of the surgery which can be expressed as rules or directives. Anyone who has trained in a surgical program knows that there are principles and dogmas and algorithms that guide you, and there's an ordered sequence for each of the procedures that we learn. The concept is, if this is encountered, then you do that. There's a process, and this is how we learn how to do procedures for lots of operations. In the left brain approach, there are many of these dogmas or rules that we remember. And I don't have to go through these in detail, and this just represents a small percentage of all the rules that we learn in this operation. The challenge is how to keep these in line with the goals, the outcome, the surface contour. This requires that our right brain is constantly engaged in the visual and spatial perception and recognition, the intuition for the final surface contour, and staying connected to the outcome at all times and not getting sort of lost in the details. If it was a purely left-brained approach, rhinoplasty would be like following a cookbook, looking at a list of tasks and completing them in order. And unfortunately, I think many surgeons do use a cookbook approach, and this is why the outcomes are not consistent, because every nose is different. On the other hand, we also don't use a purely right-brained approach. We don't simply carve and sculpt the structure of the nose into the shape that we want. In this way, if you've treated the nose like a piece of stone that you carve down, you might make a shape that's better, but it would be weaker because you haven't respected the underlying structural anatomy. That structural anatomy is divided into the septum, which is the foundation of the nose, the bones, and the cartilages which form the bridge and the tip. And ideally, those should turn out to have good surface contour, but underlying that, there should be stability and function and a long-lasting outcome. You can think of that foundation as consisting of the nasal bones, which form this rigid foundation, onto which the septal cartilage is seated. On top of that, you have the cartilages which form the bridge, and below that, the cartilages which form the tip. And all of those structures are bound together by these ligamentous attachments. In that way, this structural foundation should be addressed first. The bones are altered, either narrowed or widened or straightened. The septal foundation is corrected to set that as a stable midline structure. And that underlying foundation, and I think of that as part of the left brain component of the surgery, is essential in order to create a good surface outcome. An ideal structure is not possible with a weak foundation. And another way to say that is the foundation must be stable so an optimal structure can be built upon it. The whole brain approach, in my belief, requires going back and forth between the right and left brain and the surgeon. The right brain is important initially to analyze and assess the nose, to select goals. The left brain then must select the correct techniques and execute them meticulously. And at the end, the right brain should adjust and customize, sculpt, modulate, and assess to create that surface goal. So in review, the right brain sets the goals in aesthetics. These are not mysterious. The nose should look a certain way to maintain an attractive appearance, but also look natural. A soft, symmetrical, rounded, smooth triangular shape is ideal. The left brain can then measure and assess the parameters of the anatomy which needs to be changed, and the left brain, based on that information, can select and execute the techniques and create the structural foundation. But then toward the end of the surgery, the right brain must be active again to fine-tune that surface, to contour and to shape to make sure that the final outcome is as close to ideal as possible. In this way, the entire brain is engaged. And in general, that process goes from the inside of the nose to the outside, from the top to the bottom, from the underlying structure to the surface contour. This is one of the reasons that I get immense gratification from doing rhinoplasty. It's a very challenging procedure. I get to use my entire brain for it. It keeps me occupied and allows me to create good outcomes and satisfied patients. Thank you for joining me for this video rhinoplasty blog about whole brain rhinoplasty. I hope it gives you some insight into my approach to rhinoplasty.